Malingering and how is ruled out malingering patient by doctors. As you know, malingering is not a psychiatric disorder. It is similar but distinct from some disorders like factitious disorder and somatic symptom disorder. Malingering is purposeful production of falsely or grossly exaggerated physical and or psychological symptoms with the goal of receiving a reward. And for doctors, it is important to detect it early as possible, as a professional or an experienced doctor could detect that something is wrong with patient and symptoms are not featuring well to what doctors see in patient. So, how to rule out malingering patient? To rule out malingering patient, a careful and detailed history taking is necessary. So, history taking from patient. Watch carefully for discrepancies in person's behavior while taking a prolonged and detailed history. Dig deep into patient's personality. It is antisocial personality disorder, histrionic personality traits. Find out about the legal status of the patient, especially if it is a drug dealer or military or something else like this. Ask rapid questions and see the incoherence between answers. Ask an open-ended and leading questions. Questioning about symptoms not related to the illness faked by the patient may also induce a positive answer. The patient, not knowing much about the assumed disease, may say yes to any question. Or in any cases, patient can be informed from many sources like internet about the disease that it simulates. Watch for exaggeration of psychiatric symptoms like hallucinations and delusions. An unexpected question or doing from the doctor can be the key for detecting the falsely. Next one is the mental status exam. So many things to touch: appearance and behavior, mood, thoughts, perception, insight, and cognition. So appearance and behavior may appear disheveled, uncombed hair, untidy clothing, no eye contact, no rapport building, irritated, hostile behavior. Mood: answers low or elated and never normally euthymic. Cannot mimic, lack of affect. Anhedonia, which is a lack of pleasure. Thoughts: exaggerated delusions, but cannot mimic of formal thought disorders like schizophrenia. Confused at times with true psychiatric thought disorders, as patients with psychosis or schizophrenia can have bizarre delusions or unshakable beliefs. Perception: exaggerated hallucinations, both visual and auditory. Insight: have good insight about the disease, almost always acknowledge suffering from the disease they face. And cognition cannot be assessed properly at time because the patient may be non-compliant and may lie. They are not may lying but doing this. Multiple examinations should be performed and incoherence between the results should be noted. Various tasks are given to patients and performance on different occasions are noted. The inconsistent score in the same task performed multiple times suggests malingering. Other areas to be investigated include history of hospitalization. You can check as you are a doctor and can have access to the medical system from the computer and Take a history if patient was hospitalized, where and how many times. Medication that patient is taking. Current history of medication. Family history if one of the member from family have the similar problems or any illness close to malingering. And social history. The diagnosis of malingering is based on history, physical exam, and even psychological tests. No diagnostic laboratory tests are available to diagnose malingering, and laboratory tests are, however, useful to exclude organic cause and genesis of illness. These laboratory studies might include the following, like CBC or complete blood cell count, serum electrolytes, renal function test, liver function test, blood alcohol level. Blood and urine toxicology may also rule in malingering in case of drug abuser seeking for opioids. Computed tomography or CT scanning or magnetic resonance imaging MRI of the brain should be considered to rule out organic brain disorders. Doctors should pay attention for any type of patient and exclude the disease. And after everything is excluded, you can suspect malingering. Differential diagnosis should be made with many of the diseases, like organic cause of the disease, organic disorder, any physical illness must be ruled out before considering malingering. Conversion disorder, factitious, for example, Munchausen syndrome. Differentiate between primary and secondary external gain hypochondriasis or anxiety illness disorder, somatic symptom disorder, psychosis, schizophrenia, which are thought disorder, depression, mania or bipolar, which are mood disorders, and dissociative disorders. So once again, take a good examination from a patient and be sure that everything is okay. After you could suspect malingering and work with patient in the future, because you cannot abandon or reject patient just of malingering, as you are a doctor and should serve for patients. Thank you very much and have a great day.